Tensions erupted on Good Morning Britain as Ed Balls clashed with guest Reem Ibrahim from the Institute of Economic Affairs during a heated discussion on NHS doctors' pay. The fiery exchange, aired on May 29, 2025, drew criticism from viewers who described the debate as excruciating and polarizing. The controversy was ignited after the government proposed a pay rise of up to 5.4% for NHS doctors, which many professionals labelled as derisory. Nurses, midwives, and ambulance staff were offered an even smaller 3.6% increase, sparking further outrage across the public sector. Amid warnings from Health Secretary Wes Streeting that further strikes could choke the NHS, Balls and his co-host Susanna Reid brought in guests from both sides of the argument. Dr. Ross Newout of the Resident Doctors Committee appeared alongside Ibrahim to discuss whether NHS staff should be allowed to strike. The conversation quickly became heated as Ibrahim argued that pay in the public sector must be viewed through the lens of total government spending. She emphasized the £200 billion already allocated annually to the NHS, suggesting that better efficiency, not higher salaries, was the solution. Ed Balls countered by highlighting public support for striking doctors. 40% of people backed the strikes despite knowing it could cancel operations. Why? Because they understand that junior doctors have seen their pay fall behind for years, he said, pointing out that resident doctors earn significantly less than their private sector counterparts. The debate escalated when Ibrahim rejected the idea that public and private sectors compete directly. This is a public sector. There's no competition, she said. Balls pushed back, stating that many doctors are indeed leaving the NHS for private or overseas roles due to better pay. Ibrahim stood her ground, arguing the NHS should move toward a system that embraces public-private partnerships, as seen in countries like Germany and the Netherlands. She advocated for a more efficient use of existing funds rather than further increasing spending. Viewers took to social media, with many calling the debate painful to watch and criticizing the combative tone. The clash underscored the deep division surrounding NHS reform and the broader question of how to value public healthcare workers in a time of economic strain.